Rahim. I am Dr. Shazad Hussain, and today I will talk on the effect of diabetes on the eye. Without wasting time, I will let you know that diabetes is a chronic metabolic disorder which affects most commonly eyes and the kidneys. As far as eyes are concerned, one thing uh, you need to know that when the diabetes is diagnosed, after that uh, day, 90% of the patients 10 years after the diagnosis of diabetes, whether they have controlled diabetes or otherwise, they will develop the diabetic retinopathy. That is, whether their sugar is controlled or not controlled, 90% of the person who were diagnosed 10 years ago will have effect of diabetes on their eyes, and the part which is affected by the diabetes is the posterior part, which is called the retina, which is the main neuronal part, which is responsible for the fine vision. And this is a public awareness message, not to uh, make you people worried about it, but just to tell you how to take care of it. If the diabetes is controlled, the progression of the disease will be slowed, but it will not be stopped. And if the diabetes is uncontrolled, definitely the disease will progress. What happens in diabetes that small hemorrhages or occur on the retina, the posterior part of the eye, which is in no, uh, medical language we call it retina, and in lay people's language we call it the uh, parda. Similarly, if it is not controlled, it progresses and new blood vessels develop on the retina. That is, blood vessels which are present normally on the retina. Besides those blood vessels, new blood vessels also start appearing on the retina. It means that the disease is progressing. Now, uh, many of the times the patient is asymptomatic and his vision is 6 by 6. The take home message of this video is that if you are having diabetes, you must go to the eye specialist and get your eyes checked for diabetes. And uh, if the eye specialist says that it's okay, then he will tell you that how many months or interval or time he will you will need to come back or follow up. Usually after 6 months or every year, you should go for checkup for the follow up of the effect of the diabetes on the eye. And if some problem is occurring, then the appropriate intervention can be done. Uh, what are the interventions? It is, if detected at the right time, it is uh, totally curable disease, controllable disease rather, and I will not go in detail in the treatment, but we treat it with the help of the laser on the retina, and with the help of some injections which we inject in the eye, which stops the disease, regress the disease, and the patient's vision, if he has even lost the vision, he may get back his vision. So it is better to go to the ophthalmologist and uh, be on the safe side. Thank you very much. Hope to see you again on some other video. Uh, And if you have any questions, please feel free and post your questions without hesitation.